I believe first we ought to think about, are patients even asked and educated about clinical trials? What we find is there is an inherent bias in the healthcare system around certain patients' ability or availability to participate in clinical trials. What I've seen recently is an increase, both anecdotally and what we see on the data, of diverse patients being asked to participate in clinical trials, much more education to understand what does that really mean, removing a lot of the stigma and biases behind participating in clinical trials. The other piece is making sure that we really understand mechanistically how these diseases operate in certain patient populations, whether it is ethnicity, due to age, where there are environmental impacts where people live. And it's important that we have representation in clinical trials, whether it's through regulatory trials where you're seeking an FDA approval, or even those that are supplemental, such as medical affairs trials that would allow for diverse patient populations to participate so we better understand and target these diseases. In addition to that, we also need to understand the non-clinical barriers. So when we talk about following the science, it is what is the scientific rationale to develop a meaningful medicine that helps patients from diverse backgrounds who may be disproportionately impacted by certain types of diseases. But also we have to think about the disparities of health in terms of what are the non-clinical barriers that patients face, such as transportation insecurity, food insecurity, and other things that will prevent them from accessing healthcare equitably and at scale.